All right, let's dive right into a really fascinating question. How does your own personal DNA, your genetic code, actually decide how you'll react to a specific medicine?
You've probably been there, right? You take a painkiller that works wonders for a friend, but for you, nothing. Or maybe a doctor gives you a standard dose of something, and bam, you get hit with all these crazy side effects. So what's going on?
So, if you look at how a drug affects a huge group of people, you see this classic bell curve. Most of us are right in the middle. We get the expected effect. But then you have the outliers. On one end, you've got hyper-responders. The drug hits them really hard. On the other, poor responders, who might as well have taken a sugar pill. The key thing to realize is, this isn't just random luck.
The answer, it turns out, is hidden deep inside you. It's in your DNA. Your body's own unique instruction manual is what's behind these huge differences, and figuring that out has basically launched a whole new way of looking at medicine.
And that field has a name, pharmacogenetics. It's a bit of a mouthful, but all it means is the study of how your genes affect your response to drugs. And this is a huge deal because it's the key to finally getting away from that one-size-fits-all approach to medicine.
Okay, so how does it actually work on a genetic level? Well, it all comes down to something called a genetic polymorphism. Don't worry about the term, it's just a fancy way of saying a common variation in a gene. And the most frequent type of dysvariation is called a single nucleotide polymorphism, which everyone just calls a SNP. So, a SNP, what is it? The best way to picture it is to think of your DNA as this massive instruction manual for your body, with billions of letters. A SNP is like a single tiny typo in that manual. Just one letter is different. It's super common, lots of people have them, but that one little typo can change everything.
And here's why that tiny typo matters so much. Those instructions in your DNA, they're used to build proteins. And these proteins, especially enzymes, are the little machines in your body that process drugs. So if a typo changes the instructions, you might build a slightly different machine, and that can totally change how a drug works for you.
Let's use an analogy here because it makes it way easier to grasp. Think of your liver as this huge, bustling drug processing factory. When you swallow a pill, it shows up at the factory gates, and a whole army of tiny, specialized workers gets to work on it. And those little workers, they are the enzymes we were just talking about. There's this one big family of them called Cytochrome P450. Let's just call them CYP enzymes. These guys are the real workhorses, doing most of the heavy lifting. They're basically the MVPs of your internal factory.
And check this out. Just one of those enzymes, a specific one called CYP2D6, handles about 25%, a full quarter, of all the most common prescription drugs out there. We're talking everything from antidepressants to painkillers. So you can see how the performance of this one little worker is absolutely crucial.
Okay, so this is where those genetic typos we mentioned come back into play. They basically decide how fast your little factory workers operate. Most people are what's called extensive metabolizers. Their workers are on a normal, steady pace. But then, some people have genes that create ultra-rapid metabolizers. Their workers are on overdrive. And on the flip side, you have poor metabolizers, whose workers are super slow or maybe don't even show up for work at all.
So to really see how these different worker speeds can have life-or-death consequences, we're going to look at a perfect real-world example, the common painkiller, codeine.
Now here's the thing you have to understand about codeine. On its own, it does nothing for pain. It's what's called a prodrug. For it to actually work, our little factory worker, that CYP2D6 enzyme, has to chemically convert it into morphine. That morphine is what gives you the pain relief. That's the normal process.
But now, let's see what happens when genetics change the game. If you're a poor metabolizer, your CYP2D6 worker is basically offline. You can take codeine all day, but it never turns into morphine. The result? Zero pain relief. It's useless. But for an ultra-rapid metabolizer, whoa, it's the exact opposite, and it's incredibly dangerous. Their hyperactive workers convert the codeine into morphine way too fast, flooding their system. And the result can be a toxic, life-threatening overdose from what should be a completely normal dose. And this isn't some theoretical what-if scenario. The risk is so real that the FDA put its most serious warning, a black box warning, right on the label for codeine. It specifically calls out the risk of death in children who are ultra-rapid metabolizers. That's pharmacogenetics having a real-world impact you can see at any pharmacy. So, the codeine story is a pretty dramatic example, right? But the really important thing to know is that this isn't just about one drug.
This same principle applies across the board, and it's really shaping the future of medicine.
Yeah, this idea applies to so many other important drugs. You've got the blood thinner Plavix. Some people's genes mean they can't even activate it so it doesn't work. Or warfarin, another blood thinner, where certain genes can dramatically increase the risk of bleeding. Seriously, the list just keeps going. Heart meds, cancer drugs, you name it.
And all of this is leading us to the ultimate goal, personalized medicine. The whole idea is to stop treating people based on averages, to get away from that bell curve, and instead use your unique DNA to pick the right drug at the perfect dose just for you. It's all about getting the best possible effect with the lowest possible risk.
Now, we have to be realistic here. It's not always as simple as checking one single gene. Our response to drugs is super complex. It can be a whole bunch of genes working together, plus things like your diet, your age, even other medicines you're taking. It's a big puzzle.
So where does this all leave us? Well, it leads to a really powerful question about the future of healthcare. You know, as genetic testing gets cheaper and faster every year, are we heading towards a world where your doctor won't write a prescription without first checking your personal genetic blueprint? All the science seems to be pointing in that direction, and that day might get here sooner than any of us think.